Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on hidden secret number 9 of why you still have low thyroid symptoms even if you're taking hormone replacement therapy and if your labs look normal. In this section, we're going to continue down the pathway of talking about Hashimoto's disease and how this autoimmune attack on your body will cause problems with low thyroid symptoms. And as we talked about in the past, Hashimoto's autoimmune thyroid is an autoimmune attack whereby your body's immune system is attacking your own structures, and in this case, destroying the thyroid gland, or we talked about how it goes after TPO, or thyroid peroxidase enzyme, or thyroglobulin, which is the precursor to make T4, and in a previous video we talked about anti-TSH receptor antibodies, or TSH immunoglobulin. In this video, hidden secret number 9 is autoimmune attack against your T4 and T3 hormone itself. So again, what's going on is that with this part of Hashimoto's, the immune system is actually attacking your thyroid hormone itself and dysregulating your ability to get the thyroid hormone to your cells where it can be used to create a metabolic response. This condition remains hidden because medical doctors don't test for it, and so it remains undiagnosed, and you could be taking all kinds of thyroid hormone, and if your immune system is just taking it right out and attacking it, it's never going to get better. Now, people that have this particular problem, there's a couple specific case presentations. This is not very common, this type of problem, but it does happen, and you need to understand what's going on with this. People that have this problem routinely will have polyglandular autoimmune attack, meaning that they're going to have multiple different parts of their body being attacked by their own immune system. People that have systemic lupus erythematosus, or lupus, will have, very commonly, they'll have an autoimmune attack against T4 and T3. They will have severe autoimmune disease. People that have just all kinds of attack going on, all kinds of fire burning in their system from their immune system, just beating them up so badly. And they will have test lab positive for antibodies for T4 and T3, which is something that we can order. It's not very common that medical doctors check for this, but it is available to check. And lastly, these types of patients typically have a very bad response to bioidentical thyroid replacement hormone. Now, bioidentical is different from, say, Synthroid. Synthroid is an artificial thyroid replacement. Synthroid is a type of levothyroxine, which is artificial T4. What bioidentical is, typically like Armour, is natural, desiccated, porcine, glandular, bioidentical replacement hormones, where they take basically the thyroid gland of pigs and they dry it up and they make it into a powder, they pulverize it, and that's what you take in your capsules. And it is very similar to the type of, chemically very similar to our thyroid hormone that we take. So why is this a bad thing? Well, if you have an autoimmune attack against T3 and T4 and you give the body even more T3 and T4, what it's like doing is adding gasoline to a fire. You're just giving it more fuel to continue burning in your system. So when people they take bioidentical thyroid, their symptoms just completely get out of control. So I say you have to get back on Synthroid, you have to get back to the synthetics, because they typically don't have this problem. So bioidentical, not the way to go. Just like people that take iodine for Hashimoto's or tyrosine, those are the basic building blocks for thyroid hormone. But if you have something in your body that's attacking those things already, adding more to it is just like adding fuel to the fire. It doesn't help. I hope you enjoyed this video and I hope you learned something. If you have any questions regarding autoimmune attack against T3 or T4 or Hashimoto's or anything we talked about in this video series, please feel free to communicate with me through my website at integratedmetabolic.com. I would encourage you to also please subscribe to my YouTube channel and please tell a friend. Thank you very much for checking out this video.